Thank you for inviting me here. And I must say, Chris, that I'm definitely, with over 35 years of type 1 diabetes, part of the 77% and part of the 96%. So I can confirm these figures also for the Netherlands. I'm a husband. I'm a father of 3 teenagers. I run quite a big internet company. I'm the chairman of the supervisory board of a local bank in the Netherlands. I run marathons. I do a lot of other things. And yes, I also have type 1 diabetes. I was diagnosed at the age of 11. And since 3.5 years, I've been on the board of JDRF in the Netherlands, which was founded 3.5 years ago. And since almost 2 years now, I'm part of the T1D Voices Council, a group of patients, parents, and children advising the International Board of JDRF on their strategic research decisions. And this is quite challenging. To keep it simple for mainly the scientists here, I only made one slide. And so I think you will be able to understand it as well. First of all, I want to thank Jill for helping me with putting this together. You see we have some overcapacity in our brains as a T1D patient. And we're happy people. You see that from the smile. The point I want to make is that we're in the middle of all of this, and we make decisions with our brains, but also with our heart. And what is closest to us? That's our family, our friends, sports, work, school, the daily routines of sleeping, eating, money, of course, also important to type 1. For your own life, but also putting it into research. And the food you see there is not about carb counting. It's about fine dining. That is what's important to me and to most of T1D patients. And you can also see that you guys, the scientists, the IMI project, and the JDRF are way on the outside. You're not even getting close to my personal life on a day-to-day basis. And that's exactly what you want. You want to be very close to me, and I want to be close to you guys. But first, there's another layer. That has to do with coping with my disease. And it involves the highs and the lows, the visits to the doctors, other medicines, insulin pump. I'm still on a pen, although I know all the benefits of a pump. And I think I have access to it as well. These are the things that support me in doing what I want to do. And that is work, family, friends, sports. The thing is that when you talk to scientists and they show all these beautiful slides with all the dots, the diagrams and everything, you're always trying to reach my brain. But you're never telling me what the actual benefits for me will be in the first circle. The benefit for me and for my family and for my friends. So as long as you are not communicating to me on what is important to me, I will not be touched. And I will not spend money. Imagine that there will be no IMI. Imagine that all your research would be funded by the wallets of the patients. How would you then communicate to us? Would you not be pressed to actually give us and tell us what the actual benefits are of your research? In the end, we want better treatment, better equipment, but for me, and I think for a lot of other patients, the real important thing is to live a better life, an easier life, without the burden of all these things which are in the second layer. And then there is, and it was pointed out before, the access to drugs already available and devices already available. I think we can bring the global HbA1c level down, not by new research, but by just giving everybody access to what is already there. And that means that governments and insurers have to pay and make sure that everybody gets the right treatment with the drugs and devices already available. A lot is said about clinical trials already, and a lot of very practical insights which would help you in getting us involved. It's a risk versus benefit, and as Chris pointed out, we see the benefits, but you have to ask us. And I was never asked in the past 35 years to participate in a clinical trial. And I think patient organizations or organizations like JDRF can mitigate the emotional risk if you support these clinical trials. And maybe you can also be a distribution channel in getting to us. And indeed, it is almost impossible to get access to what trials will come up in the next 6 months, 12 years, 18 months. It's not doable for us as patients. If you want us to contribute to your work, just make sure you point out what the benefits are for us. And the benefit is not a smaller device per se. The benefit is not a new medicine or a new drug per se. The benefit should be translated into the first ring, and these are the things that are really important to me. And as long as you do not get to the first ring, you will not get to me. So good luck with that. Thank you.